Hi, I'm Anthony Ghosh, a consultant spinal neurosurgeon and founder of the Spine MDT. And in this video, we're going to talk about the timing of your spine surgery, specifically microdiscectomy for sciatica. Firstly, let's quickly discuss what I'm talking about here. So, for microdiscectomy is an operation carried out to alleviate pain that shoots down the leg. It's caused by a herniated disc. So here we have the tissue between the two bones of the spine. This is the back of the spine, the front of the spine. It's a stack of bones called vertebrae. The cushion between the two bones is the disc. Sometimes this can herniate, pinching one of the nerves that forms the sciatic nerve and sends pain down the leg. Well, in most patients with an acute disc herniation causing sciatica pain down the leg, their symptoms will settle down within the first few weeks, usually 6 up to 12 weeks. So in that time frame, we don't tend to offer surgery because studies have shown that returning to work or returning to normal daily activities is quicker if you manage it conservatively, if you take the time to recover from an operation into account. The exceptions to that rule are if you are having progressive neurological deficits, specifically motor deficits, so weakness developing in your legs, and the purpose of surgery or treatment is to try and preserve that function of your nerves and regain as much power as we can in your legs. So that's the only scenario I would offer early surgery. And you may have heard of cauda equina syndrome, where all of the nerves go to both legs and your bladder, your sphincters are affected, and you can get urinary retention or even incontinence and saddle numbness. That's a medical emergency, so that's the other exception where we would offer very early surgery and you should seek immediate attention. But what happens beyond that time frame of 2 months if you still have pain but no neurological deficit? Do you leave things alone, manage it conservatively, or do you undergo a procedure? Well, this is a literature review carried out by our colleagues in Sao Paulo, Brazil, which looked at all of the literature on conservative versus surgical treatment of sciatica with lumbar discectomy. Again, they found that up to a year, there wasn't really a significant difference in the outcome. Same number of people overall got, in most of the studies, got better. Same number of people didn't have an improvement if you compare conservative management, no operation, versus surgery. However, those that underwent surgery did return to work earlier or noticed a quicker improvement in pain than the group that didn't undergo surgery. So you tend to get better quicker and return to normal activity quicker. So potentially the pain can improve on its own even after that initial 2-month period of time. But if you want to undergo surgery, if you want to get rid of the pain quicker, get back to your routine activity quicker, when is the optimal time to have an operation? Well, this is an important study carried out by our colleagues in both the Netherlands and in Switzerland, where they use registry data. These are spinal registries where patients undergo surgery, their information gets put onto a registry, and data is collected from these patients at various time points. And that's quite useful for us to study the outcomes and how these patients got on. And what they found out was that patients who had surgery within 6 months did tend to have better outcomes overall than those that had surgery after 6 months. So the final study I want to look at is the NERVES trial. So if we're going to talk about surgery, we can't really talk about it without also discussing the option of an injection. This is a study where patients with a slipped disc, sciatica, nerve impingement and sciatica were randomized into 2 groups. One group underwent a steroid injection directed towards the trapped nerve in the spine. The other group underwent surgery. Overall, up to a year even, they found a similar result in both groups, but a very small number of patients in the injection group in the very early stages were transferred over to the surgical arm because the injection didn't work, the pain got worse, and they needed an operation. So based on that information, this is my personal protocol. If you have a slip disc causing sciatica, in the first few weeks, I try and encourage conservative management, painkillers, physiotherapy, because it will get better in the majority of people. Beyond that time frame, provided you haven't got any neurological deficits, if you have neurological deficits that I discussed earlier, then I offer an operation depending on the findings of your scan. Beyond 6 to 8 weeks or so, if you continue to have pain, then I consider an injection because it's less invasive than an operation and it can yield the same results. And if that fails, then I go down the road of a microdiscectomy operation, and I try and get that done within that 6-month time frame of the onset of symptoms. There are some exceptions to that. Sometimes I look at a scan if the disc herniation to me looks quite massive or the disc is very extruded, and depending on how much pain the patient is in, sometimes I go down the road of surgery, or try and offer surgery to that patient. But quite often it's the injection first. If that fails, then I do an operation, and I try and get that operation done within 6 months or so. Now, despite all of this, you shouldn't see this as a race against the clock. You've got to get it done within 6 months. If you're improving over that time frame and there's a gradual improvement, that doesn't mean we have to race and do it. I'd rather just sit back and see how see how things go. So it's not a hard and fast rule, but that's generally the protocol I follow. For more details on the procedures below, so microdiscectomy and transforaminal nerve block, which is the injection I was talking about, there are links below which describe that in more detail. If you found today's video helpful, please click the like button and subscribe to the channel. It really helps patients suffering with back pain or any spine disease find useful information that I try and post in this video every week. And please feel free to visit us on spinemdt.com. You can take our free online assessment tool and find out how we can help you.